Okay, so I'm really excited to introduce you to Adrian Lower, who's a consultant gynaecologist. Adrian and I have been working together for 15 years at least, I think. And it's been a really exciting part of my work because we've developed a really interesting way of working together in integrated medicine. So patients come to me and sometimes they need to have further medical treatment, and I refer to Adrian, and sometimes people come to Adrian and they need extra support around lifestyle or acupuncture. So we work together in this very seamless way, which has been really rewarding for the patient, and actually I think it's what the patient really is looking for these days. Wouldn't you agree, Adrian?
I think there's a synergy, and I'm sure that the patients that see you as well as seeing me have a much better outcome than those that were with me by themselves.
Yeah, my take on that is that both systems of medicine have something different to offer. So Western medicine is very good at emergency situations, obviously, and you have surgery and the advances in IVF, so putting the sperm and the egg together. But then looking at the diet and the lifestyle and the things that outside of that might be impacting on fertility, I think is really, really interesting and really empowering for patients as well.
And you have skills certainly in that direction that I don't have the training for that and don't have the time, frankly, to offer for that. I focus on the fixing things which are wrong. Once we fix those, and if people still don't get pregnant, then there's certainly lots more that you can offer on top of that.
So today we're going to talk about preparing for pregnancy, and I think we've both got quite a lot to say about that, so we better crack on. And so what is the sort of typical patient that comes to see you when they're not actually quite ready to have a baby, but they're thinking about having one in the future? What's your sort of advice around that?
Well, I think that's really sensible. People come because they're ready to start thinking about having a family, thinking about stopping contraception. They're worried about their age, and sadly a lot of the people who come will be getting towards the end of the reproductive years. Others are still young and they just want to do everything right. And so I generally tend to take a fairly good history, find out whether there's anything gone on in the past for either partner, male and female, that might have an impact on their fertility. For instance, the guy might have had a hernia operation as a small child, which could potentially damage the sperm tract, so that they have an obstructive problem. A woman might have had a miscarriage or a termination in the past, or a sexually transmitted infection in either couple could cause problems. So it's really important to explore these issues, and then if there's anything relevant, then we tend to do some simple tests. And initially we want to know that the woman is ovulating, the man is producing sperm, that the eggs and sperm can get together.
I think the idea about taking a really good history is really reassuring, because that's what we're taught in our training, and I think sometimes that can be missing in medicine, is that you sometimes go straight to the test, you rely on the test, and actually there's so many clues in the history. So I think that's one of the reasons why we work so well together, because I also really spend a lot of time on the history. And I always think about tests, I think they're really useful, but sometimes it can be a little bit like looking through one window of a house and deciding you need to renovate the whole house based on that one window.
Some patients come in clutching a whole sheaf of tests for me, and they say, look at this is the, and I said, hang on, let's just find out what the problem is and talk about things first, and then we'll look at the tests afterwards. It's much the best way of doing it.
Sure. And also one of the things that I'm interested in is also the mother's history and the age that she had menopause. And do you think that can play a part?
That's the best indication that we've got of when a woman is going to have a menopause. And her fertility will drop off between 5 and 10 years before she goes through the menopause. So if you're going to have the menopause around about 50, then probably 40 is getting too late to have children. But for women who will carry on having periods well into their 50s, and many do, then they've got a reasonably good chance of conceiving in their early 40s. But what I always tell people is, if you're in a relationship with somebody with whom you feel comfortable to have a child, get on and do it. as soon as you can.
Yeah, I think that's really important, and I also think there's this idea that you don't just say we're trying now and put this enormous amount of pressure on it. I think it's much better to sort of take a more gentle, laid-back approach to it.
It can take up to a year for a couple without any problems at all to conceive, and if you're 32, 33, then that year may not be so important, and it's, you know, relax and enjoy trying to start a family without putting too much pressure on yourselves. If, however, you're 38, 39, then that year of trying might be an important time, and so it's worthwhile knowing that there isn't any obvious problem stopping you from conceiving, rather than wasting a year when you could be having treatment for that. So I tend to encourage people to come for investigations earlier when they're a little older.
Sure, and I don't think it was ever meant to be that easy for us to conceive. If you think about how much time we invest in bringing up our children compared to a fish, say, for instance, who has a million fish and then just goes, you know, swims off. I think we spend a lot of time with our children bringing them up, and they can't eat or walk for quite, you know, on their own for quite a long time, and they need a lot of time and investment for us. So I think there's a perception that it's going to be really easy to have a baby, and sometimes it just takes a bit longer. So there's been a lot of interest in the last 10 years around diet and lifestyle. So I'd really like to have your take on diet and nutrition, on the role that plays.
I think it's important that one has a balanced diet. Many women these days exercise vigorously to the extent that they lose body fat. When that happens, they stop menstruating. It has a negative impact on their fertility. So I try to get people to get their lifestyle into perspective, exercise in moderation, careful with eating, make sure you maintain a reasonable normal body weight, don't diet too much, don't become too overweight, and be careful of what you're going to eat. People say, oh, I'll stop smoking when I'm pregnant. Well, if you're trying to get pregnant, stop smoking, cut down on the coffee, alcohol, reduce that to around 5 units a week. I don't think you have to stop completely, but I think that's, you know, a nice glass of wine every now and again is a sensible measure to take, but drinking a whole bottle in one night is not good.
Yeah, no, I would agree as well, and I think sometimes, I mean, there's definitely some couples who I think can benefit from not drinking, but I think on the whole having some alcohol is beneficial, and it helps with the relaxation, because I think stress is a really big issue in this as well.
We don't understand the impact of stress on people's ability to conceive, but it's quite clear that there are many people who don't conceive in spite of there being no problem, and once they no obvious medical problem that we can find, and once they take their foot off the gas, they begin to relax into accepting their situation. It's amazing how many people will conceive. People who adopt, for instance, will find that, you know, 6 months later they fall pregnant spontaneously, and who knows what the negative impact has been of the stress.
I think this will be the next 10 years. This is my prediction. Everybody heard it here first. That, you know, the last 10 years has been a lot about food and diet and advances in medicine, but I think that we're beginning to see that stress does have an impact. I mean, I guess we already know that it can affect libido and sexual function, so there's every possibility that it can affect the body in other ways as well that we just don't know how, and you know what those are yet. I would say that's very true, and I think a lot of patients that do come and see us are very stressed, and I always say to patients there's sort of two types of stress. There's stress that we can't avoid, and the stress of our own making, and the stress of our own making is that sort of obsessively gathering of information on you know, Googling everything and becoming very overwhelmed by the information that's out there. And that's why I think at some point it's really beneficial to sit down with an expert and find out what's actually pertinent to you, because a lot of the information out there, particularly on the internet, isn't going to be relevant to everybody.
No. And people always post the bad news stories, the horror stories, which happen, but that's all people post on the internet. The 99% of pregnancies which go normally pass, they don't get talked about, really.
Sure, no, that's very true. I mean, I guess the explosion of information it has a positive side to it as well, because patients are very empowered, and I think that's driven a lot of this movement towards healthy eating. But I think there is a downside to it as well, is that too much information can be a dangerous thing sometimes.
Sure. So from the nutrition perspective, I think healthy eating, avoiding certain foods, things like which might contain listeria, so unpasteurized cheeses, uncooked meats, delicatessen foods, things like that. We need to avoid those. Need to be a little bit careful about the fish. Sometimes some fish can contain mercury, so you don't want to get too high levels of mercury. A nice balanced diet, plenty of green vegetables which contain folic acid, and a lot of people ask about vitamin supplements and dietary supplements and so on. So I generally tend to tell people that we need folic acid and zinc to the minerals, calcium we need as well. In addition to that, we're finding that there's some research which suggests that coenzyme Q10 is a useful thing to take together with vitamin B, vitamin D.
Yeah, the Mediterranean diet always seems to come out well in these
yes.
studies, do they? So I like to think a nice bit of fish and a bit of oil. I think the healthy fats are really important as well. The nice cold pressed olive oil and things like that. I think we probably don't have enough good fats in our diet, and I think fat probably took a bit of a bashing in the last 20 years, and it's now sort of
swinging round, isn't it?
So sugar, I try and recommend that people really reduce sugar. I remember a Chinese medicine teacher of mine years ago, and he said, Emma, sugar makes the ovaries cystic. So I think that's quite an interesting idea in a way. And in a way, when I observe from a Chinese medicine point of view, there is a little bit of truth in that. So
that's fascinating. I'm not sure I could completely buy that sugar makes the ovaries cystic, but it is true that polycystic ovaries are potentially a pre-diabetic condition.
Absolutely.
So it may be that there's a link between sugar and polycystic ovaries, and that may be the explanation that your Chinese medicine professor was alluding to.
They're normally right.
Absolutely. I don't understand it, but I recognise the power of it, and it's interesting.
That's what's always fascinated me about the combining the different systems of medicine is sometimes these really ancient ideas, even though they're really ancient. When I, through observing many couples, suddenly they come to life, these ideas, and I see where they come from, and I see the idea and how it's developed. And 9 times out of 10, there's an awful lot of truth in it. And most of the time, we're actually saying the same thing. We're just using a very different language to explain something really similar. Anyway, it's always fascinating talking to you. So
likewise.
So in this series, we're going to cover IVF, fertility preservation, implantation, male fertility, and other subjects. So if you have any questions, please subscribe to the YouTube channel and ask me any questions underneath, and I will be getting back to you. Thank you, Adrian.
Pleasure.